Hi everyone, welcome back to my YouTube channel. I hope you are well today and I hope you are taking good care of your health. If you are new, welcome. My name is Regina Mmado. So today we'll be talking about back pain. So today's topic, I am excited discussing about it. It's not like I'm going to lecture you on this, but let's talk about our back. Let's talk about our spine. How do we take care of our spine? Because most of the time we care about other parts of our body, our skin, our hair, our this, our stomach, but we do forget about our back, our spine. How we strain the back every day during our daily activities. Back pain is not something that serious. We all do have it at one point in time. And once we take like 1 or 2 days rest, we become okay. Or maybe when you have a very stressful day, trying to finish 1 or 2 works in the office or in your workplace or in the shop. And then when you get home, you feel so tired and your back will be paining you. Then maybe if you have someone, they will massage you, you take your painkiller and then sleep. And you wake up to feel better. You won't even remember that you slept with pain. Yes, I'm not talking about this kind of pain, but there are some pains that are chronic, that even after taking rest and after taking painkillers, they don't get better. And it will be like on and off pain. If this kind of on and off pain is not taken care of, if it's not handled properly, it can result in what is called chronic back pain. I can remember back then when I would talk about my back paining me, I'll complain about back pain or waist pain. My dad would be like, "What are you saying? You're too young to complain about back pain." So most of the time I just shut my mouth because and being a young person and talking about back pain, no. We assume that back pain is only seen in elderly people. Yes, because when a person gets old, both the skin, every cell of the body, including the spine and the disc, will get weakened. And that is what results in back pain in old people. But these days, back pain is becoming so prevalent in young people that even sometimes it will alter with daily activities. Sometimes it can result in spine surgery. So if you're having back pain or you're doing some kind of work or job that involve too much standing or sitting or straining your back all the time, or you want to know how to take care of your spine so you won't develop back pain in the future, this video is for you. Don't skip, just keep watching and grab all that is necessary in order to take care of your spine and avoid chronic back pain in the future. Keep watching. So, like I said, there is nothing much to explain in this back pain because we all have had it at one point in time, just like normal body pain when you strain so much or when you hit your back or your body somewhere. But this pain will be specifically at the back. It might be upper back pain, middle back pain, or lower back pain. And it may be acute or chronic. Like if it lasts from 2 weeks to 6 weeks and then goes off after rest or medication, that is acute. But whereby the pain have lasted for 3 months, that is chronic back pain. You have to go for diagnosis and take the appropriate measure. And this acute back pain, if it's not taken care of or if it's not tackled properly, it can as well result in chronic back pain. The symptoms ranges from mild to severe. In mild back pain, you don't need any treatment, you just have to take rest and it goes off. Or you take some medication, over-the-counter medication like non-steroidal anti-inflammatory drugs and you become good. But in some cases where it's severe, you feel burning sensation at the back, tingling or at the back or the legs. You feel pinch at the nerve of the buttocks or the legs. When I say numbness, I don't know if you are from Igbo or Tangle. And also, in an emergency case, there will be urinary continency where the person will lose control of their bladder, that they will urinate out of control, or bowel movement. They will lose control over their bowel movement that they can pull at any time. Or chronic back pain that results in weight loss or fever or chills. So these symptoms is severe, like is only seen in severe back pain, and that will require immediate attention by a healthcare provider. So what could be the cause of back pain? Like I said, maybe due to the kind of work you do. Maybe the work you do include sitting whole day, or standing whole day, or bending when you're trying to type something, or you're trying to write something. This can cause back pain. Poor posture, because there is a position that will be our spine will be straight, but people of these days, including me myself, have lost the mindfulness of posting properly. That is why I said we do ignore our spine health. We sit down and position anyhow we want. Like someone will sit and be like this and be doing what they, especially pressing phone, and be pressing. Or you sit down and do like this. Or sit down and bend anyhow we want in chairs. Back pain does not just happen in a day. If you are posting poorly, if your posture is very poor, gradually you start developing back pain. Being an obese, because if your weight is too much, your spine will not be able to carry your body weight, and that will cause strain on your back. Another thing is strain. You know, our body is made up of tendon, ligament, muscles, bone, cartilages, and any changes in any of these components will affect others, because all of them work together to support our movement. So if there is anything that will alter any of this, will cause pain. To explain it, I will use elastic or rubber band as an example. There is a way you stretch it, it will bounce back. But if you stretch it beyond the limit, you see that it will remain like that. So if you strain the muscle beyond the elasticity, it will cause damage to that muscle, and that will result in pain. Because if the muscle is not proper, especially the muscle of the back, it will destabilize the spine structure. So this straining might be as a result of lifting a heavy load, twisting and bending at the same time, especially during exercise. Back pain can also be as a result of injury, like accident happen, or you fall from somewhere and then hit your back, or trauma. Another thing is medical condition like degenerative disc disease, where the disc that is in the vertebrate will degrade, and that will destabilize the structure of the spine and result in back pain. Structural problem like rupture of the disc. You know, in our vertebrae there is disc between the vertebral bone. So if this disc, which is made of cartilage, is ruptured, it will pinch the nerve, both the nerve that leads to our legs and buttocks, and that kind of pain will also result in buttocks pain or legs pain, or pinch, like sharp pain at the back, or kind of pinching pain on the legs or back or the buttocks. Another cause may be bulging disc. Like if the disc bulged, that is if it goes off from its normal structure, if it goes off from its position, and then some part will come out from the vertebra, it will press the nerve, especially the nerve called cordia equina. So when it pinches this nerve, this is bundle of nerves that leads to our legs and buttocks. So when it pinches this nerve, it will result in pain and also tingling sensation and numbness. And this bulging might be as a result of injury or trauma or overstraining or accident. So another cause is arthritis. Arthritis is autoimmune disease. It mainly affects the joint, and it can also affect the spine, and that will result in spine stenosis, because this arthritis will try to narrow the space where the spinal cord is located, or the space where other nerves pass through to our legs. Another cause is osteoporosis. Osteoporosis is a condition where the bone will become brittle and easily be broken, and that will also affect the vertebral bone. Another cause is sleeping in a bad mattress. some mattress like foam, depending on the type and also the quality, you realize that when you sleep on it for a long time, it will compress at the middle, like where your weight is much, like your buttock or your shoulder. It will press down in that area. So when you lie down in that kind of mattress, it doesn't support or straighten the spine. Like after you have a very long day and come back to rest, instead of resting your spine properly, you are even breaking it the more by resting or by sleeping on that bad mattress. So like I said, it's not like it will happen just one day, but as you continue sleeping in this poor mattress day by day, with time you will develop back pain. Another cause of back pain is kidney problem. Yes, kidney problem do result in back pain. Another cause of back pain is tumor in the spine or spine cancer. In this spine tumor or spine cancer, there will be overgrowth of the cell, and that will press the nerve as well. Another cause is infection, spinal infection caused by sugars. Another cause is being pregnant. Yes, many pregnant women do suffer from back pain because when the baby is growing, the back structure is also changing, and that will result in back pain. And the last but not the least is sedentary lifestyle. Sedentary lifestyle is lack of exercise. That is when someone is lazy, being lazy. They don't want to engage in anything. This day, let me say, these technology days have made everything so easy for us that things we do with our hands are very less. For washing clothes, we have machine. For traveling, we have machine. For washing plates, there is machine. Even for pressing iron, there is machine. Almost everything we do have machine that will support us or help us to do it very fast. That things we do, be it in office or workplace, with our hands are very less. But in fact, it's remaining for us to even look for something that will feed us, like that will put food in our mouth and feed us. For some people, they don't want to do anything. Everything, like we totally depend on machine. And this reduces our activities. And remember, our body is just like every other engine. If you park your car or your bike or your generator or any of your engine for a very long time, you don't use it. Any day you go to on them, you just observe the sound. It will sound like something that have damaged. It won't work as it should if you are using it every day. So is our body. If you don't move your body, just sit down in one place, just eat, go to the toilet, come back, sit down, press phone, that is all. You don't engage in any physical activities. My dear, you are killing yourself. And because you are not using the body as supposed, it will start to lose its function. So that sedentary lifestyle can also cause back pain. Try to engage in some activities. So now I'm going to talk about the diagnosis. So normally, if you have back pain that after some rest, maybe have 1 day rest and take medication, you are fine, you don't need diagnosis. It's for those that have this chronic back pain that have lasted more than 3 months and the symptoms doesn't go away after rest and after taking painkillers. Then you need to go for diagnosis to know exactly what is wrong. Earlier the better, because if you don't diagnose it earlier and wait until it becomes debilitating and also loss of urinary continence that it will require emergency case, sorry, it might be too late for you by that time. So don't wait for your case to be very severe in order to get diagnosed. So it's true that back pain is normal for everyone, but in some cases it can lead to disability. Yes, chronic back pain and severe one can lead to disability. So if your back pain has become chronic, it doesn't go away even after taking medication or rest, go for diagnosis and don't allow it to reach the level of leading to disability. Some of the diagnoses they will carry out is by asking you question about the symptoms, how long it have lasted, and also some physical examination like doing MRI, that is magnetic resonance imaging, CT scan or X-ray. This will help to show and indicate the place where the problem is on your spine. If it's upper back pain, lower back pain, middle back pain, and which vertebra or which disc is affected and exactly what is wrong, so that they will know the treatment measure that they can start up for you. So this comes to the end of this video. I hope you enjoyed this video. If you do, give me a thumbs up and share to your friends and family. Let's take care of our spine. Do have yourself a good day. Bye bye.